Good afternoon. My name is Manika Pai, and I'm a hematologist, methodologist, and the vice chair of ASH-a's Guideline Oversight Subcommittee. I'm excited to talk to you today about clinical practice guidelines. We're going to discuss what makes them trustworthy, where you can find guidelines that inspire confidence, and how you can use guidelines in your practice. You can think of a guideline like a roadmap that helps you diagnose and treat your patients in a standardized, evidence-based way. These are recommendations that help providers, patients, and other stakeholders make informed decisions. Guidelines are helpful when there's real uncertainty in care decisions. And unlike topic reviews, guidelines don't tell us how things work, they tell us what works. Guidelines are not meant to be cookbooks. They synthesize published and unpublished evidence, but also incorporate patient values and preferences, as well as clinical judgment. In 2011, the Institute of Medicine published a set of standards for trustworthy guidelines. The IOM recommended that guidelines be developed using clear methods and systematic evidence reviews. The patient should be at the center of the ultimate recommendations, and transparency should exist to minimize conflict of interest, distortion, and biases. Now, ideally, guidelines should be informed by very high-quality data, like randomized trials or well-designed observational studies. This allows the panel to make confident recommendations. But a recent paper showed that over the last 2 decades, just 10% of recommendations in cardiology guidelines were based on high-quality randomized data. And this proportion has not changed over the last 2 decades. A 1999 paper showed that less than 25% of malignant hematology recommendations were based on high-quality RCTs. Another red flag is a guideline with an outdated evidence base. Research in some hematologic diseases moves fast, and in others it moves very slowly. But regardless of the tempo, an updating plan should capture important, practice-changing evidence. Conflict of interest can exert undue influence on guideline recommendations, so it's a major red flag if a guideline doesn't explicitly disclose panelist conflicts and ensure that the majority of the panel, including the chairs, is conflict-free. Now, conflict of interest can easily come to light, and it can limit your professional growth as a trainee. So if you're keen to pursue guideline work, try to minimize conflict, especially financial, and if you have it, disclose it honestly and completely. The best place to find trustworthy guidelines is right here at ASH. ASH produces a number of valuable guidance documents, including our How I Treat articles and consensus statements. But our transparent, rigorous guidelines all meet and exceed the IOM's quality standards. ASH guidelines are exclusively published in Blood Advances, and they're available at the point of care on the ASH Guidelines app. You can also find teaching slides, pocket guides, implementation toolkits, and patient stories linked to our guidelines online. ASH may also endorse or affirm value of guidelines from external organizations. We provide web links to selected high-quality hematology guidelines from other societies as a service to our members. Now, once you can identify that you can trust a guideline, you can use it to give your patients the best care. Now, all guideline recommendations have 2 parts, direction and strength. The direction weighs all the evidence and actually tells us what to do. Meanwhile, the strength is the confidence the guideline panel had in making the recommendation. Now, I'm going to show you a real recommendation from one of ASH's VTE guidelines. So you see that the direction is against measuring drug levels, but because the recommendation is based on very low quality observational data, that recommendation is conditional. We also call conditional recommendations weak. Now, the direction of a recommendation incorporates a lot of panel judgments, not just about the risk-benefit data, but also about stakeholder preference, cost, whether the treatment would work in the real world, and how the treatment impacts health equity. Meanwhile, the strength directly reflects the quality of the evidence. A strong recommendation implies high quality and obliges us to act. Most clinicians would support strong recommendations, and most patients in this position would prefer them as well. A conditional recommendation is based on weaker data, especially in hematology, where we often deal with rare diseases with no large RCTs. We have to resort to issuing conditional recommendations. And this can be very confusing for guideline users, but it shouldn't be. A conditional recommendation does not mean the guideline is leaving you high and dry or that you should do nothing. All it means is we don't have a high-quality answer to your important clinical question. So we'll suggest what you should do and ask you to proceed with extra caution and awareness. So you can cross the road, just look both ways first. You can use a conditional recommendation to make a decision. Just consider all the factors involved, including your patient's unique values and needs. This is a great opportunity for shared decision-making, and you can even fill the evidence gap with your own high-quality research. In summary, remember that external standards help determine if a guideline is trustworthy. You can find high-quality guidelines through ASH. Using their recommendations and involving patients in your decision-making will help you provide thoughtful, evidence-based care. Thank you.